I am Dr. Billy Mela Odhiambo from Kenya, and I'm an obstetrician and gynecologist at the Medicity. I've come for the laparoscopy and hysteroscopy course, doing FMAS, DMAS, and FIH. So before I came, I had done a few cases of laparoscopy in Kenya. Actually, I was more of assisting other surgeons. But right now with this training, it's given me a lot of confidence. When I go back, I'll be able to do these cases on my own. So it's really built my confidence, and I feel skill-wise, I'm very skilled at this point compared to before. So initially, from the paper cutting, it's very difficult to get into it when you start, especially the eye coordination. It's very difficult. You miss a lot and take a lot of time when you start cutting. But as you do it over time, it becomes easier and easier. The depth perception becomes easier. So by the time you're doing the wet lab from the dry lab, it's actually, you find it very easy. And it's almost, from the wet lab, it was very interesting because it's almost like it's human. Yeah, so over time, you start slowly. It's very difficult and frustrating initially because of handling the instrument and getting the perception. But as you continue, then it even becomes interesting. Once you know it's very interesting. So after this training, back home I do both public practice and also private practice. And private practice, I know I'll be able to do a lot of, especially hysteroscopy, a lot of indications, and patients and women who will benefit from this skill, because we don't get to do it a lot, so we miss a lot of pathologies. So when I go back, it will be an opportunity for me and also the women that I see to support them and actually get to have some diagnosis for them. And this was not happening before. Let me start from the training staff. They are I think all of them, they're very, very friendly, and they're also very skilled. And what I liked about it is that they really start from basics. They don't harass you. They give you time to train and to get your skills. So they teach you almost like you're a child, like you know nothing. So when someone gives you that time, and it builds confidence over time, and they're very patient with you. So they are very helpful and very friendly. Whenever you ask them something to demonstrate, they're always there. Whenever you want any question, they always answer back and tell you exactly what to do. And then the faculty, I've also learned from professors and the doctors who are very experienced. We got to learn from the experience and previous mistakes. So they are giving us actually live experience that you can learn from, what to do. So this is not something you can get in any other book, because you can read many books for laparoscopy, but now they're giving us the experience, and they have very many years experience, over 30 years experience. And so it was very good, getting to hear from them. Previously, I've watched some YouTube videos, seen them in the YouTube, so it was very nice seeing them in person and getting to interact and actually ask them the questions that I had before when I was watching the videos. So very, very nice experience. And also the staff upstairs, from the reception, how they received us, everything, the orientation was very good. I've learned anatomy right from the day I started medical school, reading in books, dissecting. But actually the anatomy you see during laparoscopy, and especially the 3D, what it gives you, the anatomy, is you learned about everything. After watching the live surgeries, you actually know where everything is. Ureteric dissection, where the ureter is, you can see them clearly. So whatever you read in books and tells you about how the cause of the ureter is, you actually see it quite well. So it builds your confidence, because during surgery, you know exactly where the structures are, what to avoid, what injuries to avoid. So I learned a lot from just observing. It was a very, 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 very good learning experience, both for laparoscopy and hysteroscopy. Other than that, there was also the robotic, which is, of course, new. It's coming up, but you also got to experience the robotic surgeries. So very, very good experience. Yes, we observed different cases, and the interesting thing is, actually most cases, they were a combination of both hysteroscopy and laparoscopy in the same patient. And so, because the patients who have pathologies both inside the uterus and outside. And there are cases where you have to do both so that one assists the other. So it was even the hysteroscopy aspect was very good. And some of the cases, we had very, very interesting cases in the OT. When you're learning on your own, at times, you don't have that guide. You don't know where to start, where else to go. So for example, if I'm just watching back at home, I'll just open one and observe and start. But the structured learning, it helps in that there's a starting point and then you progress slowly, step by step. So you start simple and get to graduate to more difficult things. So I think the structured learning is quite well, and it gets you and you feel confident at the end of the day, as opposed to watching a video you'll watch but it does not build your confidence as much. And also interacting face to face with the faculty, the doctors, the professors, yes, you get quite a lot of knowledge from them that you'll not get if you're not present physically. Yes, the wet lab is very good because it's like a human. It's actually like a human being, because it's the animal, and So the experience was good because from the dry lab, even the depth perception and all that you get in wet lab is like the same as human experience, what you'd have. So yes, the wet lab is a very good place to learn, and you actually do all the skills that you're doing in the wet lab. You'll do suturing, handling of tissue handling, the way you handle tissues gently, cutting, and those are real tissues as opposed to when you're cutting a paper. So once you do the paper and you get the skill well, then you translate it now to the real tissues. It's a different feel, because the paper and the tissue does not feel the same way. And you're going to do surgeries on real patients. I would advise everyone, every doctor who is a surgeon, gynecologist who is aspiring or would love to learn laparoscopy or minimal access surgery, my advice would be it's a good starting point. And not only those who are starting, even those who are already in practice. There are a lot of people are practicing without this training, but there's a lot that they'll miss. Even in our class, we had someone who has been doing this over time, but I had a talk with him and he told me that actually this has really improved his skills, especially in terms of suturing. Yeah, so I would advise every doctor who is doing surgery to have this training. And if you have it early enough in your career, then you have a lot of time to build and to perfect it, because laparoscopy has a very long learning curve. So if you want to do it late in your career, then you're going to have very little time to enjoy the practice. But the moment you become a doctor and you get this skill, just the same way we get the skills that time when you're getting the skills for open surgeries, that is also the same time you should get the skills for laparoscopy, so that over years you perfect your skill when you're still young. So yeah, I'm very grateful for this opportunity and chance. Not everyone gets the opportunity to come for such trainings, especially coming far from Kenya and getting here. I really appreciate that I was given the opportunity and the chance to learn from actually people who are very experienced and the best in the fields. They were very helpful and very, very kind to us. I'm thankful for this, and it's going to really benefit my patients in future.